Yeah.
Good afternoon, everyone. David Jordan with United Methodist Health Ministry Fund. We are going to go ahead and get started. First, thank you all for joining. We are so excited to see the turnout for this meeting. Given the large turnout, please put your mic on mute during the presentation, and people are already modeling great behavior. Please introduce yourself in the chat. We are excited for today's webinar. As background, the United Methodist Health Ministry Fund is a statewide health foundation located in Hutchinson. Our mission is to improve the health of all Kansans. As part of our work, we focus on improving access to care, improving early childhood development, and building healthy congregations and healthy communities. Our investments and work spans programs, grant investments, policy, and convening partners. As part of our work, we recognize that there is a need for sustainable funding for services in Kansas, especially in rural communities and underserved communities of color. We also know that we can't sustain critical healthcare and early childhood development services on our own as a foundation or even with state general fund dollars. We need to bring back federal dollars to Kansas to ensure sustainability of proven programs and ensure people have access to services. As a whole, we don't do a great job in drawing down federal funds, whether or not they're grant dollars or whether or not they're drawing down federal programs like Medicaid expansion, TANF, Child Care Development Block grants. As a whole, Kansas ranks 47th out of the 50 states in drawing down federal funds, and drawing down. So now we have the opportunity to bring billions of dollars back as a result of the various pandemic relief bills. We want to make sure as a state that we're prepared for this opportunity and that our partners, all of you on the ground, are prepared. And we thought this webinar was a great opportunity to start that discussion so that we can work together to change the fact that we're close to the bottom of the states of bringing federal dollars back to our communities. So as these dollars will be distributed, we wanted to make sure that today's conversation focused on what opportunities exist, how to be prepared for those opportunities, and both in the chat and later in the presentation, we want to hear from you about how, what resources are needed to take advantage of these opportunities. We're so excited to have Julie Assel with us today. Julie's been working with the Health Fund over the last 3 years to help support grant writing services for the Health Fund and for partner organizations. Together, we've brought back millions of dollars to Kansas through this partnership. Julie and her team specialize in federal grants. This is definitely not a sales pitch in any way, but an opportunity to understand from our partners what grant programs we expect to arise, how you all can prepare for them, and as I mentioned a minute ago, how we can help support efforts to apply for federal grants and what's needed on the ground to take advantage of this unprecedented opportunity. Before turning things over to Julie, I wanted to remind folks of the ground rules. Please put your mic on mute during the presentation. We won't have enough time to introduce everyone, so please let us know who you are in the chat box. We will be recording this and also responding to questions. Julie has 2 of her team members monitoring the chat, both to help facilitate questions and answers during the presentation, as well as to compile every question asked in the chat and capture it. We'll be developing an FAQ, specifically in response to this learning session that we'll send out with the recording to all participants. And then the program is very straightforward. Welcome and introductions. We're doing that right now. Julie will lead the discussion and presentation on American Rescue Plan grant opportunities and writing tips. We'll have time for some question and answers and discussions, and then we'll talk a little bit more about next steps. Hopefully this is an interactive process as much as possible with over 150 folks participating. We're really excited by this and look forward to taking advantage of these opportunities and hopefully making sure that we can support you in other learnings that might be helpful. This is the first of what we're viewing now as of at least a 2-part series, but if there's other ideas for series on how to take advantage of federal opportunities, that's one thing we'd like to hear about. In 2 weeks, which we'll highlight more at the end of the conversation, we're going to have a presentation on how organizations can engage in advocacy to leverage ARP dollars to improve community and state efforts. So with that, I'll turn things over to Julie, and thank you again for joining us.
Thank you, David. I am very excited to talk with you today about the American Rescue Plan Act, as talking about federal grants is one of my favorite activities. I've been writing federal grants for nearly 20 years now, and to be honest, I kind of feel like I've cut my professional teeth on writing federal grants. A significant portion, for example, of my first full-time grant job was writing to federal agencies for a major urban school district. And as I look back at my professional work history, it still ranks as one of my favorite jobs, as I had the opportunity to make a major difference for students and teachers in my community at large. And that's really one of the best reasons to apply for federal funding. So feel free to tell us about your federal experience, your interest in federal grants. And I'm going to start out by having my colleague Leah give us our first poll for the day. This one will kind of give me an idea about people's level of grant experience and grant readiness. So here we're asking whether you've applied for federal grants before, whether you've done your federal registrations, like having an active SAM registration, whether you don't have that, or you're not sure, or you're not even sure who SAM is. Now, in addition to the poll, as David's already mentioned, I'd love it if you'd share who you are, where you're coming from, and maybe even some of your own experience with federal grants, whether at your current agency or in your prior experience. I know I've seen at least some people on this call already who I know are grant writers themselves with federal experience, some of whom we work with actually there in the state of Kansas. While I haven't quite written to all of the federal agencies, I've written to quite a few, so I'm going to try and make as many of my examples relevant to those of you who are in attendance today. You can also add maybe what federal agency or agencies you are the most interested in, or if you're unsure, kind of the general topic area. Then, of course, you can send, as David said, any comments or questions via the chat as well. Now, in response to all of my questions about you, here's a little bit about me. I've been writing and teaching about grants for nearly 20 years now. I'm a credentialed grant professional from the Grant Professional Certification Institute, and I'm an approved trainer from the Grant Professionals Association. While my company has a broad range of grants experience, I have personally written to the Departments of Agriculture, Education, Health and Human Services, Homeland Security, Housing and Urban Development, as well as the Environmental Protection Agency, National Endowment for the Arts, National Endowment for the Humanities, and the National Science Foundation. There's often a perception that federal grants are only for agencies that have these really large budgets, but many of the grants that are coming out now are actually aimed at smaller nonprofits, or they're providing set-asides for smaller agencies, rural areas, smaller communities, because they have an understanding that these are key agencies in communities across the country. So we're actually going to send out a second poll for you today to say, who do we have on the call? Kind of like, what size budget do you have, right? Just again, to help me tailor my presentation, do we have organizations that are less than $500,000, up to $1 million, 10 million, 50 million, or even greater than 50 million? Now, I know that not everyone has had the opportunity to write federal grants, but a lot of organizations are feeling pressured right now to investigate if these new influxes of money from the federal government have anything in them for them, which might be of benefit for their agency. So I also want to ask you how you feel about federal grants. Here are some choices. One, great, I love federal grants. I write them all the time. I'm excited to see what investments the American Recovery Plan Act and other federal bills are making. Or are you more cautiously optimistic, right? Saying, well, there appears to be more grants than in the past that might fit with your mission. Or for some people, this is a level of frustration. Hey, even with all this investment, I still feel like there's nothing in here for us. And there may still be also those of you that are new and you're just here to learn, and that's great. So while you answer that poll, I want to tell you a little bit about ASO Grant Services. As David mentioned, we really are federal grant experts. We research funding opportunities, review proposals for clients, who write the proposals themselves. We help clients design competitive projects, help them develop policies and procedures required to implement their projects successfully within the federal guidelines. And we help clients write detailed reports about their outcomes. And the reality is we do this for nonprofits, governments, healthcare systems, behavioral health systems, centers, institutions of higher education, school districts. We've worked with organizations with large federal grant portfolios and organizations who are applying for and managing their first federal grant application and everything in between. So the results of our poll are going to show a variety of things. Leah, as you close that poll, can you tell me how many we have who are excited, what percent we have that are excited about today's ARPA funding?
Well, we have, are you talking about people who have applied before for federal grants?
Yeah, the ones that are writing all the time, all that kind of stuff.
45%.
That's wonderful. That's really great. How about the cautiously optimistic?
16% are registered but haven't applied yet.
Okay, all right. So so that's you're talking about the second poll. Okay. Can we launch the third poll, Leah?
Sure.
All right, this one's going to actually ask all of you how you feel about these opportunities. Yeah, somebody just mentioned in the chat that that third poll not quite out yet. So we'll get back to that. And I'll tell you a little bit more about the focus, right, of today's call. For those of you who are unfamiliar with ARPA, which is short, right, for American Recovery Plan Act, here's some background information. So on March 11, 2021, President Biden signed the American Rescue Plan. This plan is often referred to as ARPA or ARP. It was $1.9 trillion. It has a primary focus of combating, obviously, the COVID-19 pandemic. So it includes both public health dollars and also economic impacts the United States has been experiencing since March of 2020. These funds can be broken up and talked about in many different ways. But as agencies, most of us really want to know, hey, what money is really available and how can we be prepared to apply for it? So we're going to talk today about a bunch of numbers in a variety of ways so that people can really see what's in the bill. So often these big giant bills are passed and people don't really know what's in them. So Leah, are we able to close that poll and see what people are excited about or not excited about in the ARPA bill?
Sure. So we've got about 8% that are excited. We have 39% who are cautiously optimistic.
Okay, that's more actually like what I was kind of expecting.
Sure. 12% are frustrated, and 41% just don't know yet.
Okay, well, let's hope today's presentation today will help move some of those people out of the last category into at least one of the others. Okay, so of that $1.9 trillion, about $656 billion has been earmarked for direct financial assistance. What does that mean? Well, in general, this funding is not going to be competitive from a proposal perspective. We already know that it was competitive to get PPP grants or various tax credits, but about 2/3 of this funding is coming out in the direct stimulus checks. But you can also see money for unemployment, economic disaster loans, and fraud protection funding as well. Second, about $56 billion was marked for assistance to individuals and families. In this category, there are some direct assistance programs, but most of the time, this is additional funding coming out through programs that already exist to help individuals who are struggling with poverty. This may include food, rent, homelessness. It also includes programs, though, for the elderly, programs for pregnant women, infants, and children under the ages of 5, and programs related to child abuse and family violence. So here, for example, is a listing of supports for food programs. You can see SNAP, WIC, EBT, supplemental commodities, and nutrition assistance. This is great for social service agencies who have had many people coming to their agency looking to apply for these direct benefit programs because they're out of work. These individuals have also been looking for assistance with housing, and housing programs received funding for things like rental assistance, homeowner assistance, utility assistance, and some money specifically set aside for rural housing assistance. Most of this money is being distributed to state and local government programs, which social service agencies apply to regularly. But with so much to give away, this is a great time for new organizations to apply and for current organizations to really show these government agencies what capacity they have to help. Now, there are also a real mix of other programs which saw increases in funding, which directly help individuals and families. These include $17 billion for Veterans Affairs, $3 billion for the Individuals with Disabilities Education Act, $450 million for family violence prevention and services, $250 million for community-based child abuse prevention, $100 million for child abuse prevention and treatment state grants, $1 billion for pandemic emergency assistance, $1.4 billion for the Older Americans Act programs, $276 million for Elder Justice Act grants, $150 million for maternal, infant, and early childhood home visitation programs, and $50 million for family planning. Now, in these areas, there have been and continue to be a variety of grants available. Some have been coming through the state and some have been coming through the federal government. For example, right now, there are 2 grants forecasted on grants.gov related to family planning through the Office of the Assistant Secretary for Health. There's a family planning service delivery grant program and a family planning telehealth infrastructure enhancement and expansion grant program. The first anticipates awarding about 90 grants of 150,000 to 21 million. They've got 258 million set aside for that program, and the grant is anticipated to be due in January of 2022. The second anticipates awarding about 70 grants between 50,000 and 700,000. So it doesn't have to be these huge programs that people are trying to access. They have about 45 million set aside for that program, which is currently forecasted to be open in October and due in January 2022. And the federal government's doing better than usual about forecasting grant opportunities, especially with this money through ARPA. But we're going to talk more about how to keep ahead on forecasted grants later in our presentation today. Now, the next category is education and childcare. $211 billion was marked for this area. And I know that we have quite a few people in the childcare industry on our call today. Over 3/4 of this money is direct payments to school districts, but there are some other interesting items here for people who are interested in competitive opportunities. For example, nearly $15 billion is going to childcare and development block grants, which states really dictate how that funding is distributed. And while $10 million was now allocated to the National Child Traumatic Stress Network, the anticipation is that this funding is going to be competitively distributed via grants. So for this funding, we really recommend that you pay close attention to how your state is handling these dollars. And honestly, the state of Kansas doesn't have that fully straightened out yet for their plan, and they're not alone. Many other states are in the same situation. Now, as you might expect, a significant amount of funding has been put into this bill for health, specifically related to COVID-19. Overall, $86 billion earmarked for health, right? So this slide shows funding marked for COVID-19, and some of it is for grants, right? So there's testing and vaccines, but like the vaccine confidence education, that actually was a grant that came out and was targeted heavily towards rural communities. $8.5 billion for provider relief, $7.5 billion for community health centers, $500 million for state nursing home strike teams, and $500 million for emergency rural development grants for rural health care. Now, we've already seen the grants for vaccine confidence come out, and this last item, for example, are actually grants currently available from the Department of Agriculture. This makes it a little bit trickier to manage because often grants from the Department of Agriculture only fund a portion of projects. So we're really recommending to people to look at projects they're already planning to do, kind of like what the old shovel-ready projects that were funded during the last economic downturn through ARPA, or the American Reinvestment and Recovery Act. These two USDA grants have different tracks, right? So the first one, the recovery grants, must be used to support immediate healthcare needs stemming from the COVID-19 pandemic to help prepare for a future pandemic event and to increase access to quality healthcare services and improve community health outcomes. These grants range from just $25,000 to $1 million, and they have about $350 million of kind of what's been allocated in $500 million that's going to be put into that track. The key here is contacting your local rural development office. I'm going to drop a link to that listing of those rural development offices here in the chat. Reach out to them, discuss this grant, and then submit your application. Because each rural development state office is going to conduct the review, rating, and selection from the complete applications. The first kind of deadline is those who might be received by October 12th, but then they're going to continue receiving applications on an ongoing basis until all those funds have been exhausted. The second one is their impact grants. These are going to be used to support long-term sustainability of rural healthcare. Long-term sustainability is defined as improved health outcomes, improved access to quality healthcare, and creating or maintaining sustainable economic development for small communities. These grants are going to range between $5 and $10 million. So no joke here, significant. And the formula to decide how much the match is really a discussion with your state office. But there's $125 million in these Track 2 grants. So contacting your local rural development office to discuss with them where you're going to serve, who all the partners are, what really your target population is key to saying, okay, this is what we want to do for rural Kansas, for example. All of these applications, though, have to be received by October 12th, and that's when awards are going to be made. They're not going to be on a rolling basis, okay? Now, another significant area in this bill is behavioral health, which includes both mental health and substance use. Here, you're going to see certified community behavioral health clinic expansion grants, youth suicide, community mental health services, substance abuse prevention and treatment, community-based local substance use disorder services, community-based funding for local behavioral health needs, and then some money for Project Aware. Now, almost all of these grants are going to be competitive through the federal government. But for example, $1.5 billion here that was listed for the Community Mental Health Services Block Grant, SAMHSA actually ended up distributing half of that funding directly to community mental health centers based upon their size, and then took the other half and made it into a competitive opportunity for those same community mental health centers to tell SAMHSA how they would address specific areas targeted by SAMHSA. In fact, of the $750 million, which was distributed under this block grant for competitive grants, 12 Kansas mental health centers were awarded over $36 million to be spent over the next 2 years. This is great for Kansas, and it's a great example of how these funds are not just limited to urban communities across the United States. These agencies, the association and partners made a concerted effort to bring these dollars to Kansas, and it definitely paid off. Neighboring Missouri, only half as many awards, 7 awards, $25 million. Iowa, 5 awards, only $16 million. Nebraska, 1 award, okay? So Kansas brought in nearly as much as Missouri and Iowa put together. Agencies like SAMHSA are doing a great job in forecasting these opportunities. So it's really important, I think, to keep your eye out there. Now, even before the current healthcare workforce crisis, the government knew it needed to invest more in diversifying the health and behavioral health workforce. So here are the amounts written in this bill. I think we're going to continue to see even more invested, though, from the federal government in coming years and coming bills. Now, while some of these programs are helping to forgive loans taken out by students in these programs, others are grant programs. For example, the Teaching Health Centers Graduate Medical Education Program. It's currently available due at the end of September. So clearly, if you're not already planning on it, it's probably not going to be a good match for you this year. But most of these workforce grants will be available through HRSA, the Health Resources and Services Administration. They've also been doing a great job forecasting their opportunities. This means that organizations have time to reach out to their local universities or whatever universities you use, maybe in the past or are thinking about using in the future to recruit your upcoming workforce. Okay, you have time to reach out to them to say, how can we partner and how can we work with you to put together a competitive grant opportunity to grow the health workforce in Kansas? Because the reality is based on the pandemic, this need is going to be national. But Kansas had this need before the pandemic. So I think it's vital that the universities and the health and behavioral health systems work together and say, here's the numbers. Here's how many openings we have. This is, how long it takes for us to hire someone. This is how much we're having to pay because of the shortage. These are all important data points that make for a competitive grant application. So then, of course, there's also grants for industries that have been hard hit by the pandemic, including transportation. 40 billion have been marked for this area. Here, there's formula grants, operating assistance grants, and capital investment grants. There's also, though, a bipartisan infrastructure bill that's been passed by the Senate, and it's in the House right now, that will include $550 billion in new federal investments in the infrastructure over the next 5 years, focusing on roads, bridges, and public transportation. Okay, so know that more's coming. We really do believe that what's important for our conversation, especially today, is how to be prepared. Okay, and because what's really coming out there. Now, 61 billion has also been marked for other programs. And some people really pushed back on some of these other programs to say, well, why are they included? But you guys, it's a federal bill. We've got to have people, work together to get this kind of legislation passed. Okay, so here there's everything from disaster relief for FEMA and various emergency programs, the firefighters and emergency responders, to other areas that Congress decided were affected by the pandemic, like the arts, broadband internet access, and various economic development programs. Many of these are grant programs. Some were available earlier this year, like the NEA grants. Some are available now, like the emergency connectivity funds. And others are ones we're expecting in the next year because they're scheduled to be part of larger funding pools to current grant opportunities, like that fire and emergency response grant. Now, this is a lot of numbers. So our last slide, I promise here, for numbers is going to be 362 billion that's been marked for state and local fiscal recovery funds. What does that mean? Well, this includes direct, flexible aid to every state and county in America. Each government entity has some guidelines about how they can spend these funds, but it's pretty flexible. So grant programs are absolutely expected. In addition, relationship building. There's also going to be significant amount of funding that these counties and local governments and state governments are going to be eligible for, but in partnership with entities in their community who are actually the ones who provide the services. So the real question really is for everyone, How can you find grant opportunities you as your agency needs, right? So here's a list of the federal agencies getting the bulk of the funding out of the bill. It's a long slide, okay? One of the most challenging aspects of this bill, even for professionals like myself, is how this money is going to be distributed. So first and foremost, there absolutely will be grant opportunities announced via the Federal Register and listed in grants.gov. My recommendation for organizations who really want to access these dollars is to be looking at grants.gov no less than weekly. This is what we do. We monitor these agencies for organizations. We let them know when forecasts and deadlines are listed, but there's no cost other than your time, which is valuable, to be doing that research on grants.gov. So if you find grants.gov overwhelming or you're unsure how to make that research efficient, I will tell you that we have kind of a federal find and fit course that you can take, and I'll drop that link here in the chat. But the reality is, I'm going to tell you some of these techniques right now. Okay. One of the easiest ways, type in American Rescue Plan in the keyword search box on the top basic search criteria box. Okay. Right now, if you do that, there are 600 posted opportunities and 160 forecasted opportunities. Now, like other foundation databases, typing more than one word increases the number of grant opportunities which come up. Okay, so the reality is you want to put it in quotes if you use more than one word. Here you get 24 posted targeted grants specifically from the American Rescue Plan. The difference here is the quotes, okay? Otherwise you get words scattered about. I also like acronyms like ARPA or ARP. ARP. The keyword might be inside the RFP, not just the name of the RFP. And for those of you that are new to this, RFP, request for proposal. I know that seems odd, but it can be helpful. Now, grants.gov is considered a very broad database with some unique filters along the left. So in general, you're looking for forecasted and posted grants. They're the most commonly searched. And so the grants.gov actually automatically selects that when you get to that page. I also, though, like to use closed opportunity status. If I know a grant opportunity was available last year, or like in the since October 1 of last year, so in the last federal fiscal year, because I want to learn about it before it comes out again this year. I also, for funding instrument type, most opportunities you're going to look at are going to be grants or cooperative agreements. The key difference between these two is the federal government is much more involved at the project level, not just the management reporting level for a cooperative agreement. Here, the government is not just funding your project, but frankly, they're also working with you to ensure that you are providing the service that they want provided in the way they want it done. We're seeing a lot of that as well with ARPA funds. And we have several grants that have been awarded from CMS for the state of Kansas in this way, for example. Agencies, I like to start out by looking at all the agencies that have possible funding using my keywords. But using the agency filters is a way to keep things that otherwise are showing up really broad and narrowing them and making them tailored. For example, I have a client who's a comprehensive community behavioral health organization providing substance abuse and mental health services. And they have specifically tasked me for the last several years to take a look at what grants come out from SAMHSA. That's the Substance Abuse and Mental Health Services Administration. Now, SAMHSA is actually a sub-agency under the Department of Health and Human Services. So I can click on a little box and see and scroll down just for SAMHSA grants, and it narrows it down significantly for me. Another one is going to be eligibility. This is one of my favorite filters, but it can also be one of the most frustrating. It is always such a bummer for me to read a really great grant opportunity only to find out that the organization who would be a great match, not eligible, okay? You will see the largest number of grant opportunities are going to be for city, county, and even state government agencies. There are tribes, nonprofits, institutions of higher educations that make up a good many of the rest of the opportunities. But we encourage you all to not just think about what grants you personally can apply for, but also opportunities where another organization is the applicant and you could be a partner in the project. Because again, a lot of these ARPA grants are going to come out aimed at government. But if government doesn't provide those services in your community, you do as a local nonprofit or hospital or behavioral health center, you need to be building those relationships with your government now, okay? And speaking of partnerships, like many foundations, the federal government is quite interested in organizations working together in partnership to accomplish the objectives of grant opportunities. Some grants are going to require you to have multiple partners. Others are going to simply make you document who your partners are. This documentation can vary from grant to grant and department to department. For example, a grant from the Department of Justice earlier this year required a very specific MOU to be completed by both parties. A grant for the National Science Foundation is recommending letters of support or commitment from school districts who are referral partners. And a third grant from SAMHSA is looking for a list of organizations who are specific partners meeting objectives and letters of commitment. Be very careful about whether they need letters of commitment or an MOU. These take time, sometimes lawyers, ideally not. So don't go into these grants lightly if you're thinking about writing a grant quickly, okay? I would also tell you that if you have to have a partnership with, let's say, your probation office or someone like that, and some of these substance use disorder grants do require those types of things. Once you start getting into the justice system, sometimes it takes longer for them to review those letters of commitment or MOUs. So again, start building those relationships now. I talk with a lot of organizations who are writing grants for consortiums of agencies about who is the best applicant. This can be a sensitive subject, as many organizations, let's be honest, don't fully trust each other, because the way funding is set up, they're kind of naturally pitted against each other for funding. But having an organization who has the internal processes and procedures to handle grant funding, whether federal or otherwise, is very helpful. For example, I've worked with school districts, universities, hospitals who already receive federal funding, but they're managing their first competitive federal grant. Going through the training to complete drawdowns for federal funding, reporting requirements, and audits can sound scary if you've never done it before. And personally, I think the financial personnel are naturally conservative. So you don't necessarily want to judge whether you should go after something based on whether your finance staff are excited that you're looking at federal funding. So they know how much work it is to track this funding, and they're typically very busy personnel. But I think if you start those conversations now, it makes it a lot easier, okay? And as I mentioned earlier, I recommend that you're out on grants.gov on a weekly basis. Now, one of the options that you have here is to kind of save your search. It won't literally save the search you're working on, but it'll serve the search criteria you're using. So you can be consistent about it as you go in the future. And the benefit to that is that if I've gone through all of this and I've gone through and I figured out exactly what agency I want, what eligibility category is, all of these different things, from an efficiency perspective, I don't want to type it in again. So if I can go back to it and I can't remember when I saved it, I can do save search. Within all of this though, I have same fields and I can name it, okay? Then if you want to come back to it, you can't recall it, you can just click manage searches and it'll show you the last 15 searches that you did. Once you go to view results, you can manipulate results because they come across as a comma separated value file, which is similar to an Excel file, which we'll talk about in just a second. If you really want to dig into these lists, and maybe you don't have time to do a whole list all in one sitting, you want to export detailed data. It's going to download as a comma separated value file. It looks like Excel, but it's not yet, so watch out. I recommend saving the file as Excel right away. Otherwise, all the work you're going to do with the file, like hiding columns, filtering, and sorting, is going to be lost. because those are Excel features, not CSV features. It's like the difference between Word and a text file, right? Now, when you name it, know that the current title of the document when you download it is actually not a random list of numbers. This will actually tell you the date you did this search in 2021, right? So 2021 is the first set of numbers, and then 0929 is the month and the date, and then they use the 24-hour clock, right? So as an example, this would be 12, it wouldn't be 12, it'd be, no, yeah, we haven't reached 1 o'clock yet. So 12:43, and actually it would be 13:43 because it's Eastern time. They even give you the seconds. Now, I personally like to give you, keep raw data, but then copy and paste it into another worksheet to arrange it. If you want to learn about that exact procedure we use for cleaning up data, I'm going to give you an SOP that you can, a standard operating procedure that we use, that you can then download. It will also give you a base from which you can decide how to tailor the information for your own agency's needs. This allows me to do searches kind of in short bursts instead of sitting down to do research over the course of a day. And there's many other ways we can do this, but we have again, a training that you guys might be interested about researching grants. Now, if you don't have time to do that, you can reach out to organizations like us, but that's completely up to you. As David said, this is not a sales thing, right? So the second and third places, though, we want you to be looking for funding is kind of dependent upon your state, right? So some states are funneling all of their ARPA funding into one office for distribution, but most are sectioning it out by department so as to not overwhelm any one office. And most of the states and local governments, honestly, they haven't been prepared to manage and distribute these funds, no matter how much they're needed and wanted. So we recommend that you reach out to your county and city officials to see what partnering opportunities might there be to leverage the funds your municipality is receiving. While some are prepared to spend the dollars that are directly allocated to their government offices' recovery, others are not ready to distribute the funding which is allocated to them, especially the counties or even state offices, which typically manage much smaller budgets. So what this means is that you need to be looking at the offices within your local states, which kind of correspond to these funding pools. So the Department of Elementary and Secondary Education, the Economic Development Offices, the Housing and Homelessness Programs, any of those types of things, the Departments of Mental Health, et cetera, to see where these funds are being funneled. I'm a firm believer that all nonprofit organizations should have a strong relationship with their federal, state, and local government officials, whether you agree with their politics or not. Their job is to advocate for their constituents who you serve. It's important that your voice is heard because often the voice of those in need is drowned out by those who have a lot of money or power. And just in case you don't feel like your industry was touched by this bill, you should remember that Congress is talking about two very significant additional bills, an infrastructure bill and a budget resolution currently at $3.5 trillion that they're being talked about. So all of this stuff I'm teaching you here today will be true for current federal funding or future bills being passed. Now, ideally, you want to be able to get information about these grant opportunities within 1 to 2 weeks of them being released. So, but no matter how much time they give you, it will never feel like enough time. So don't go with your gut about, oh, do we have enough time to do this? Okay. Now, some of these agencies are already forecasting opportunities like the Substance Abuse Mental Health Services Administration, like the Health Resources and Services Administration, into next spring. These are agencies who have received quite a few dollars from this bill and are already planning to funnel this money through programs that already exist. So your first step is to stay on top of the grant opportunities to be ready to react when one is right for you. This includes staying in touch with those legislators. Second, make sure you're registered to do business with the federal government. Unlike portals run by foundations, there are multiple registrations involved. Ensuring first, you have a tax identification number or an employee identification number. Second, making sure you have a DUNS number, that's Data Universal Numbering System, or depending upon when you do it, it may be called the unique identity identifier that they're moving to. Then, and this is the more time consuming process, you need to be registered with the System for Award Management, frequently called SAM. That's what we were joking about at the beginning. Do you know who SAM is? And then grants.gov. Then, depending upon which federal agency you're applying to, there may be additional agency specific portals, but those take a shorter period of time. Now, third, make sure that each office in your agency is actually on board with receiving federal funding. This may include your finance staff, executive and program leadership, and your board of directors. You want to have strong buy-in from all the important people first. Key initial items to have ready for this decision include: 1, how much is the grant worth? What can we spend the dollars on, including whether indirect cost is allowed and how much? Okay. Second, when looking at a grant, does that grant pay for staffing? Are there particular staffing requirements like a project director? And how many years does the grant cover? Organizations think about how long they can keep a staff person's salary paid for, whether they're keeping them tied up in a project, and whether raises and benefit increases can be built into the grant. And 3, how does this grant align with what the organization already does? The mission, the services, the target population. If it requires evidence-based programs, make sure the organization is prepared to implement them. If it requires activities they don't currently provide, you have to be prepared to talk through that too. A go, no-go decision could hinge on any of these items or seem unsurmountable, or at least not worth the time if you don't spend the time ahead of time, okay? Now, fourth, whether you have the opportunity to work from an RFP that was released for your program last year, or whether you're simply looking at other RFPs put out by the agency you're watching, I would recommend creating an initial checklist of likely attachments you will need to submit. Items that will be able to be collected in advance could be your indirect cost rate agreement, bids for materials to be purchases or services to be negotiated, resumes, biographical sketches. In addition, if most of the grants require partners, you want to start having the conversations with the appropriate agencies in your community. I also like to make the finance office aware with the type of budget forms we're going to see, so they have time to think about how to translate their account codes to the correct federal categories. And 5, I like to have draft logic models or work plans created. I know they won't be perfect at this point, but if I can get my program and executive staff thinking about how a program can be expressed using these formats, I'm going to have an easier and quicker time getting them to see how the RFP fits with the program after the grant opportunity is released. Now, if you've never heard about or case statements before, I know that organizations may have absolutely not heard about logic models or work plans, okay? But logic models are great for program planning for federal grants, as it's not uncommon for a federal grant to affect more than one department at an agency or more than one agency in a community. Doing this work in advance helps it makes it much more unlikely that all the organizations in a community are doing a money grab when RFP is finally released. Work together. That's, one of my key takeaways, right? So, and speaking of key takeaways, here we are before questions, right? Grants.gov is your friend, but not all the money is going to be coming out that way. Some grants have already passed, more is coming, and prepare now. Determine what you can do to prepare yourself and your agency. Determine whether you're going to need outside help or not. If not, prepare your internal staff. Now, I'm going to start to open it up to questions. Leah is the other staff person I have on here. Do we have any questions in the chat, Leah, or has everybody just been like, oh?
We haven't had any questions come through just yet. We had a couple people chime in with excitement about the SAMHSA money coming through. And Michael Perigo did have a comment. I wanted to make sure people heard about USDA, that the rural development grants are capped by median income per county. So his example is that Harvey County would receive a cap of 15% of the cost of the project, and it's a match, and they offer a 30-year, 2.5% long-term loan that can be used as the match. So good tip there.
Yeah, that's really great. Thanks so much for providing that.
And then Sue Ann just commented that she believes today is the start of applications for HRSA.
Yep, that sounds about right. Okay. There's a repeat on USDA. So in essence, what exists is that the USDA's rural development grants are capped by what's considered median income per county. Okay, so he gave the example of Harvey County, which has they're based upon the median income in a county. They have this formula that says, okay, well, USDA is only going to pay for X% of this project. So he gave the example of Harvey County that they have a cap of 15%. They would only pay for 15% of that because the median income is relatively high. Okay, it does range, I think, between 15% and 90%, but we're seeing almost nobody at the 90%. We're seeing quite a few people at the, I think it's 55 or 65% range. But they did note that they do offer 30-year, 2.5% long-term loans that can be used as that match. Okay. All right, so now we're starting. What state agencies in Kansas have ARPA funding? There's going to be a lot of agencies that are going to have it. And we know, for example, that there's going to be money that's going to come through the child development block grants, right? As an example. But we also know that some of the money is coming through what's the equivalent to the Health and Human Services departments in Kansas. David, do you have other agencies that you know are still considering that? In the state of Kansas, I think they're still trying to figure it out, aren't they?
I think that the Kansas Department of Health and Environment is the equivalent on this from a state agency standpoint. So, and their Office of Rural Health and Primary Care actually sends out a good email that sort of updates folks on regular grant opportunities. I think that there's continues to be work in progress at the state level as they've reconfigured the statewide committee or authority, sort of looking at the overall fund distribution that consists of representation from the governor's office and the appointees of the legislature. So that that sort of group is still, the rules are still being determined, and it's not as definitive as maybe some other states.
Yeah. And I mean, the reality is I think states are still trying to figure it out. So somebody asked, when applying, should I apply as my hospital or as a hospital foundation, which would be better if both are nonprofit? If both are nonprofit, typically the hospital is going to look stronger unless your foundation has a history of getting federal dollars, mostly because they frequently feel better because your hospital is already managing, reimbursement and those types of things. So they have a little bit more confidence in the fiscal structure that exists there. That said, I know other agencies that just always apply through their foundation. But if you haven't done it before, your foundation may have more of a structure in place for managing grants than your hospital system. Okay, so those are aspects for you to consider as an entity. Okay, some other questions. Grants for housing and supportive housing. Yes, those are coming out from the Housing and Urban Development. Some of them have been continuations where they've given money through the COCs as well. So, for example, in that particular case, Allison, I know you're going to take a look at your local COC. That's where most of those monies are going to come through for the Kansas City metropolitan area. It's going to be true throughout Kansas to, if you're interested in housing or supportive housing, to go to your local COC, who's going to be doing those applications. Let's see, any other questions? Anybody wants to drop anything else, either in the chat or just live ask a question? Okay. Well, I want to make sure that if people are looking for contact information, that I've got mine. I do want to thank David and the Health Fund for sponsoring today's webinar. Turn it back over to you, David.
Thank you, Julie. And thanks to everyone for joining us. We want to keep this to an hour just to be respectful of everyone's time. As I mentioned, we'll be doing a webinar in 2 weeks on the 14th from noon to 1 p.m. on how groups can work through advocacy to make sure we're leveraging federal dollars, grant dollars in a way that benefits communities in the state. So that will be an exciting webinar delivered by our partners at Community Catalyst with a more advocacy approach. However, as I mentioned, all these questions and anything else you may send offline. So I'd encourage you to email Julie or anyone on our team, David at healthfund.org, Katie at healthfund.org, Lindsay at healthfund.org, with any questions or any suggestions beyond, because we'll compile a list of questions and then maybe some other common Q&As and send it out with this recording. We also just want any thoughts or feedback, if you could put them in the chat now or send us emails on what resources might be helpful as you think about applying for grants, whether or not it's being connected with other folks that were on this call by subject area, or some thoughts and advice on how you might partner with different groups or state agencies. I think we'd love to hear what might be needed to make you successful in applying for these grants or finding partnerships so that you can develop those at the local or regional level to apply for these grants. As Julie mentioned, we've had success working through just in the last month grant awards on outreach and enrollment dollars with some local agencies and with some of those community mental health centers and supporting those efforts. And we want to continue to be responsive because we know that the Health Fund and all of our philanthropic partners don't have the same level of resources that will be available. And these federal dollars are critical to sustaining services in Kansas, which is why we want to be as helpful as possible. So please drop any questions or thoughts, feedback for us in the chat, or reach out to us, and we will compile sort of learnings from this session, send it out with the recording, and also let you know about the next webinar. But if there's other also topics to cover, we're happy to put together sort of a webinar series, because this is just of critical importance to our state, making sure that we're bringing back these federal dollars to Kansas. So thank you so much for your time, for joining us, and please send feedback, drop things in the chat, let us know what you need. We want to be partners with you in this effort. So thanks so much and have a great day.
Thanks, everyone.